Imagine you're planning a wedding. You've spent months agonizing over the guest list. You've had the dress tailored perfectly, the caterer is booked, and you are just totally exhausted.
Oh, yeah, the baseline stress of just existing during wedding planning it's a lot.
Right. But then as you're scrolling through social media for honeymoon ideas, this ad pops up. And it tells you that to truly prepare for your wedding night, you need to book an appointment to have your own blood drawn, spun in a high-speed centrifuge, and then injected back into your most highly sensitive, intimate anatomy.
Yeah, that is quite the escalation from, a traditional manicure or a gold leaf facial, to say the least.
Definitely. Welcome to the deep dive. Today, our mission is to explore exactly how we got here. We're looking at a procedure you might have seen buzzed about online or, in wellness magazines called the O shot or the orgasm shot.
Right. This is a treatment promising to just completely revolutionize female sexual health. And it's a procedure that sits right at this collision point of genuine medical innovation, profound cultural pressures, and just incredibly savvy marketing.
It really does. And to navigate that, we've gathered a really fascinating stack of sources for you. We're looking at the actual clinical guidelines from medical spas performing the procedure. We have this highly revealing interview with the shot's inventor, Dr. Charles Ronels.
And to ground us in the cultural reality, we are also bringing in a critical investigative report from the Times of India that looks at how this is actually being sold today.
Now, just to set the parameters for our deep dive today, it's important to clarify our objective. We are going to tether ourselves strictly to what these clinical and journalistic sources reveal.
Right, because there's a lot of noise out there.
Exactly. I mean, we know there are highly specific debates regarding advanced anatomical targeting, which we will touch on, like the specific fan array injection techniques for hitting Halban's fascia. But our focus is to look at the broader biological mechanics as presented in the literature.
Yeah, separated entirely from the marketing hype. We are examining both the really enthusiastic claims of regenerative medicine and the cautious pushback from mainstream gynecologists.
Okay, let's unpack this, starting with the physical reality of what this actually is. Because beneath the catchy branding, the foundation of the O shot relies on a very established medical mechanism called platelet-rich plasma, or PRP.
Yes, PRP is essentially the biological engine here. So if you were to walk into a clinic for this, it begins very routinely. I mean, it just starts with a standard blood draw from your arm, usually just a small vial or two.
Then what? They don't just turn around and inject the whole blood back in, right?
No, no. The whole blood is essentially just the raw material. So they place that vial into a centrifuge, which spins the blood at thousands of revolutions per minute.
Okay, to separate it out.
Exactly. The goal is to separate the red blood cells, which they just discard, from the plasma, and, crucially, the platelets.
Now, I think most of us, when we hear platelets, we just think of that sticky stuff that forms a scab when we get a paper cut.
Right. Their role in clotting is basically what we all learn in high school biology. But what modern regenerative medicine focuses on is what is actually inside them.
Because they aren't just passive. Right.
Exactly. They aren't just passive building blocks for a scab. They are incredibly active signaling mechanisms. They're just packed with growth factors.
And the sources list some really intense jargon here, like platelet-derived growth factor, transforming growth factor, epidermal growth factor, and VEGF, vascular endothelial growth factor.
It's a mouthful, yeah.
I think it's important we don't just gloss over those names, though. What are these things actually doing in the body?
Well, let's break it down. Take VEGF, for instance. Vascular endothelial growth factor is essentially the body's chemical signal to lay down new biological plumbing. It commands the tissue to build brand new blood vessels.
And more blood vessels mean a higher capacity for blood flow.
Which is the fundamental physical requirement for physical arousal. So in the clinic, once they extract this concentrated plasma full of platelets, they often activate it.
Right. The sources mentioned using a 10% calcium chloride solution for that.
Yeah, and that's a really crucial step.
So that calcium chloride acts as a sort of chemical alarm clock. It wakes the platelets up and tells them they're at an injury site, even though they aren't.
That's a really good way to look at it. The calcium chloride literally bursts the platelets open, so they just dump all those growth factors at once.
Oh, wow.
And when this activated serum is injected back into the body, Those growth factors hunt down unipotent stem cells in the local tissue.
And just to clarify for the listener, when we say stem cells, we aren't talking about, embryonic stem cells that can turn into anything.
Right, no.
Unipotent stem cells are already assigned to that specific tissue type, right? They're just kind of sitting there on standby, waiting for a signal to multiply.
Correct. They are adult stem cells already embedded right there in the tissue. So this massive flood of growth factors hits them, and they start multiplying.
Leading to new blood vessel formation.
Yep. New blood vessels, new collagen production, and actual tissue regeneration.
Okay, so that brings us to the actual procedure, which is where things get a bit, eye-watering.
Right.
Because we are talking about injecting this fluid
Right.
into highly sensitive anatomical targets.
Yeah, it sounds daunting, but the clinical guidelines say it's just an outpatient procedure taking about 30 to 60 minutes.
And understandably, the first question patients ask is about pain. Clinics apparently apply a pharmaceutical-grade topical anesthetic cream for 20 to 30 minutes before the injections.
And because of that, patients routinely rate the pain at a 0 or a 1 out of 10.
Which is a massive relief, because the targets are incredibly specific. They use a very fine needle to inject about 4 milliliters of the PRP into the anterior vaginal wall.
Right, and the exact anatomy here is super important. This is where we get into that advanced targeting we mentioned earlier.
Okay, lay it on me. How do they know exactly where to go?
So practitioners use what's called a fan array injection technique. They aren't just poking blindly, they are specifically targeting a structure called Halban's fascia.
Halban's fascia, what exactly is that?
It's basically a layer of connective tissue that sits right between the bladder and the anterior vaginal wall. It's heavily populated with nerves and vascular structures.
So it's sort of the prime real estate for arousal.
Exactly. To hit it perfectly, the clinician uses specific anatomical landmarks. They locate the urethral meatus, the opening of the urethra, and the anterior vaginal fornix.
Okay, I'm picturing it.
And by using those landmarks, they insert the needle and fan it out, depositing the PRP in a spreading pattern across that fascial layer. This ensures the fluid completely bathes the area near the skiing glands.
Which is the area often referred to as the O spot or G spot. And clinical ultrasound imaging taken during the procedure actually shows this fluid spreading out and doing exactly that, right?
Yeah, it completely bathes the tissue. And then they take another milliliter and inject it directly into the clitoral area.
Right, specifically targeting the corpus cavernosum near the glands, which makes total sense mechanically. The corpus cavernosum is the spongy erectile tissue.
Yeah, it's the exact same tissue structure found in male anatomy.
So if you're trying to improve arousal, that's the exact tissue that needs to engorge with blood. So hearing all this, I have this image forming. It's not just like giving the body raw materials.
What do you mean?
It's like dropping a construction crew with a megaphone into a vacant lot. They aren't just bringing bricks. They are actively shouting for the body to build new roads, the blood vessels, and lay down new concrete, the collagen, where there was previously nothing happening.
It is an aggressive intervention, yeah. You are forcing a building phase in tissue that was otherwise just dormant.
But wait, I have to ask. If this is just our own blood and our own natural healing factors, why do we need a doctor with a centrifuge and a needle to move it an inch or two?
That's the logical next question, right?
Yeah, doesn't the body heal itself naturally? If that tissue needed repair, wouldn't the platelets just, go there?
What's fascinating here is that the human body is a highly efficient machine, but it is also extremely conservative with its resources.
Okay.
The body will not naturally flood these specific tissues with that massive concentration of growth factors unless there is a catastrophic acute injury, like a major laceration.
Oh. So the body requires a literal emergency to deploy the heavy machinery.
Exactly. The centrifuge process artificially concentrates this regenerative power to levels the tissue would simply never experience on its own under everyday circumstances.
That is wild.
Yeah, by spinning the blood and using that calcium chloride trigger, you're effectively tricking the local tissue into a massive localized healing response, but without having to actually inflict a massive injury first.
Okay, that makes the biological mechanics make sense. We are artificially inducing a repair state. But let's look at how this was actually conceptualized.
Right, the origin story.
Yeah, if we look at the interview with the inventor, Dr. Charles Roddels, his background completely frames why this shot even exists.
It really does. Ronalds didn't start his career trying to solve female sexual dysfunction. He was a research chemist, then an ER doctor, and significantly, he ran a wound care center.
So he was dealing with severe diabetic ulcers, major burns, non-healing wounds. And that's where he became an expert in using PRP because it was already established in heavy-duty wound care.
Right. And later in his career, he transitioned into aesthetics. He started applying that same wound healing technology to cosmetic facial injections.
We have that.
Yep, that's the origin of the vampire facial that all those celebrities made famous.
I remember that trend.
He saw that injecting PRP into the face created new volume and revived the skin by building that new vascular plumbing we just discussed.
And according to his interview, he had a realization. He literally said he realized he had a, quote, better place than the face for new volume and blood flow.
Very catchy.
Right. But beyond the mechanical leap from face to sexual organs, what I found deeply compelling in the sources was his philosophy on what he calls the orgasm system.
This is where we move from pure biology into physiology and psychology. Runels points out that traditional medicine often treats sexual function like a light switch.
Just a binary physical button that is either on or off.
Exactly. But it's an incredibly complex ecosystem.
You have the nervous system firing signals. You have a whole cocktail of hormones, right?
Yeah.
Like testosterone driving the baseline libido, oxytocin fostering a sense of safety and connection, prolactin playing its role.
And layered on top of all that, biology is the psychological state of the patient. Runels introduces this concept of the spiral of sexual experience, which is really crucial for understanding why he argues this physical shot is necessary.
The downward and upward spirals. This was such a fascinating part of the reading for me.
Yeah, it makes a lot of intuitive sense.
He explains that if a person has a painful or traumatic physical experience during intimacy, let's say they have severe scarring from childbirth that makes intercourse physically painful, it creates a downward spiral. The brain literally learns that intimacy equals pain.
And once the brain anticipates pain, it activates the sympathetic nervous system, the fight or flight response.
Right.
That adrenaline completely overrides the parasympathetic system, which is what controls arousal and lubrication. So the anticipation of pain literally kills the body's ability to become aroused, which causes more friction, which causes more pain. It's a compounding loop.
Conversely, an upward spiral happens when the experience is pain-free and positive. The body learns to anticipate pleasure, the nervous system relaxes, and arousal becomes naturally easier over time.
The body learns to trust the experience again.
So what does this all mean? Wait, hold on. I actually have to push back on this hardware versus software idea.
Okay, go for it.
If the downward spiral is driven by the brain's anticipation, by anxiety and fear, isn't it highly reductive to think a localized injection of blood plasma can fix what is fundamentally a psychological loop?
You are touching on the exact tension that critics point out. But to be fair to Dr. Runels, he doesn't claim this is a cure-all for psychological trauma. He says very explicitly in the interview that the O shot is not a magic bullet.
He did note that if the issue is a toxic dynamic with a partner or deep psychological trauma where the physical anatomy is perfectly healthy, the shot is not the right tool.
Yeah.
You can't, inject your way out of a bad relationship.
Right. But his argument is about sequence. If that downward psychological spiral was originally triggered by localized physical pain, what the medical field calls dyspareunia, or by physical numbness from nerve damage, then addressing that physical hardware issue is the mandatory first step.
I guess you can't ask a patient to just psychologically relax and overcome the fact that their pelvic tissue is actively transmitting sharp pain signals to their brain.
Exactly. You have to shut off the physical alarm bell first. If the PRP can regenerate that scarred or damaged tissue, making it pliable and pain-free again, you remove the biological trigger for the anxiety.
And only then can the psychological healing of the upward spiral begin.
Precisely.
Which makes a lot of sense for clinical patients. The sources note this is being used to treat some very specific, debilitating medical conditions.
Yeah, it's not just for arousal.
Like stress urinary incontinence, where they inject the PRP to strengthen the weakened tissues that support the urethra.
It's also utilized for lichen sclerosis, which is an incredibly painful chronic skin condition that affects the vulva, causing tearing and severe discomfort. For patients with these conditions, regenerating that tissue is strictly about restoring baseline quality of life.
But this is where the story takes a massive turn. Because while the O-shot might have been theorized as a way to treat pain and severe dysfunction, that is not how it's predominantly being consumed in the real world today.
No, not at all.
It has basically leaked out of the strict medical clinic and flooded into the lifestyle wellness space.
It's a textbook example of a medical intervention being repackaged as an optimization tool.
Enter the Times of India investigative report. This was wild to read. According to their reporting, the O-shot is being aggressively marketed to Indian brides as a necessary part of their pre-wedding preparation.
Just think about what the traditional bridal checklist used to be. It was surface-level aesthetic treatments. You'd get a gold leaf facial for a bridal glow. You'd get a manicure, maybe some body sculpting.
But now, medical spas are pushing treatments aimed at physically optimizing the internal anatomy for the honeymoon.
Yeah!
The article quotes marketing materials pushing the O-shot to brides specifically to, quote, increase sexual sensation, improve arousal, and boost natural lubrication right before the wedding night.
If we connect this to the bigger picture, we are seeing something profound happening to the way society views the female body.
It's unsettling.
A procedure designed to heal severe trauma or dysfunction is being sold to healthy women as a luxury consumer good. It subtly implies that even a healthy, functioning body isn't optimized enough for a honeymoon.
I want you, the listener, to pause and just imagine the weight of that. You're trying to coordinate a wedding. You're stressed about family dynamics, the catering, the massive financial costs.
The seating arrangements alone, right?
Exactly. And on top of all of that, your social media feed is telling you that you are somehow anatomically inadequate and you need to spend thousands of dollars to inject stem cell stimulating plasma into your pelvis to ensure your honeymoon is perfect. The pressure is just suffocating.
It absolutely blurs the line between a patient seeking relief from a medical issue and a consumer buying a product to achieve this, impossible, idealized version of intimacy.
Which brings us to the medical pushback. Here's where it gets really interesting. Because mainstream traditional gynecology is looking at this med spa bridal marketing trend and slamming on the emergency brake.
The pushback in the Times of India piece is unambiguous. They interviewed leading, highly respected gynecologists like Dr. Tripti Raheja and Dr. Juhi Jain, and their clinical reality check is pretty stark.
They don't dismiss the concept entirely, though. They acknowledge there were some small pilot studies out there. There was one from a Turkish OBGYN clinic that showed patients subjectively reporting improvements in their libido and function after the shot.
Right, there is some data.
But when you look at the broader, rigorous scientific consensus, it is a very different story.
A major 2023 systematic review looked at all of the available literature regarding the efficacy and safety of PRP injections for female sexual dysfunction and stress urinary incontinence.
And what did they find?
Their ultimate conclusion was that there is no clear evidence that these injections actually improve female sexual dysfunction compared to a placebo.
No clear evidence. And both Dr. Raheja and Dr. Jain emphasize a massive caveat that med spas often leave off their glossy brochures. The procedure is not FDA approved for treating sexual problems.
Dr. Jain was incredibly direct about it. She refuses to endorse it as evidence-based gynecological care, warning patients that it is fundamentally an investigational experimental procedure.
And we also need to address the safety aspect, because the marketing heavily leans on words like natural and holistic. Since it's just your own blood, the implication is that it's completely risk-free.
That's a really dangerous assumption. Anytime you break the skin, especially in an area so dense with nerves and blood vessels, there is risk.
Yeah, you're still using a needle.
Exactly. The doctors note potential side effects, and while mostly temporary, they include pain, swelling, bleeding, nerve sensitivity, and in rare but serious cases, infection or permanent tissue scarring.
Okay, so let's look at the contradiction here. If the large-scale systematic clinical trials don't definitively back it up, and leading gynecologists are calling it unproven and experimental, why are so many women reporting incredible, life-changing results?
The clinics are booming.
Right. The med spas are packed, the wait lists are long. Is this entirely just a very expensive placebo effect?
Well, it's a complex dynamic. First, we absolutely have to acknowledge the power of the placebo effect, particularly in treatments involving sexual health and psychology. The brain is literally the largest sexual organ.
For sure.
So if you invest significant time, money, and hope into a procedure that you are told will fix you, your brain is highly primed to experience a positive outcome.
The expectation of the upward spiral literally creates the upward spiral.
Exactly. But it would be a mistake to dismiss this entirely as just naive consumers buying a placebo. There is a much deeper systemic issue at play here.
Which is?
Female sexual dysfunction has historically been drastically under-researched, underfunded, and frequently just dismissed by traditional medicine.
Oh, man. Reynolds actually made a startling point about this in his interview. He referenced research showing that when women bring up sexual pain to their primary care doctors or even gynecologists, the doctors actively change the subject over half the time.
They change the subject. Because traditional medicine often doesn't have a pill to prescribe for it, and honestly, a lot of doctors are just uncomfortable discussing it.
So you have this massive population of women dealing with real physical pain, real numbness, and immense emotional frustration. They go to their trusted doctor for help, and they literally get a shrug and a change of subject.
And nature abhors a vacuum, right? When the traditional medical establishment leaves women's pain unaddressed, the commercial wellness industry will gladly step in to fill the void.
For a fee, of course.
Exactly. The extreme popularity of the O-shot might be less about its proven double-blind efficacy and much more about a desperate, unmet demand for solutions in a system that ignores them.
If your doctor ignores you, but a pristine med spa offers you a scientific-sounding stem cell repair serum that acknowledges your pain and promises a fix, I mean, of course you're going to try it. Women are just tired of being ignored.
Precisely. They are seeking agency over their own bodies in a system that often denies it to them.
Wow. We have covered a vast amount of territory on this deep dive. We started with the microscopic reality of platelet-rich plasma, how a centrifuge and a chemical trigger can take a simple blood draw and turn it into a concentrated serum that commands the body to build new blood vessels and collagen.
We examine the intersection of biology and psychology through the orgasm system, looking at how regenerating damaged tissue might be the necessary first step to breaking a downward spiral of anticipated pain.
And we looked at the startling cultural reality of how this theoretical medical treatment has morphed, how it went from treating severe diabetic wounds to treating painful vaginal scarring to being aggressively marketed to perfectly healthy brides as a luxury honeymoon optimization tool.
All despite the glaring lack of FDA approval and clear clinical evidence.
The O-shot is currently living right on the boundary line of modern medicine. The science of PRP is incredibly well documented for healing severe external wounds.
But its application in sexual wellness is caught in this murky gray area between promising, innovative relief for ignored patients and highly profitable, unproven hype.
It radically changes how you look at the intersection of medicine and the wellness industry. Which brings me to a final thought I want to leave you with today. We talked a lot about the pressure to be optimized.
Oh, yeah, constant optimization.
If we are now reaching a cultural point where people are willing to proactively inject stem cell stimulating plasma into their most intimate anatomy just to optimize their honeymoon, how long until this level of intervention is no longer considered a luxury, but a baseline expectation?
That's a scary thought.
Are we moving toward a future where our most private, natural physiological functions are viewed just like dental hygiene or going to the gym, just another biological metric that we are expected to constantly, expensively biohack in order to be considered acceptable?
It raises profound questions about what it means to just exist naturally in our own bodies.
It really does. Thank you for joining us on this deep dive.